As COVID cases spike once again, testing has also increased. But is access to testing the same as it was at the peak of the pandemic? And is it a pain to book an appointment? That's what you probably want to know. Well, we bring in Dr. Donnie Aga with Kelsey-Seybold Clinic to answer those very questions and more. Good morning to you. Great to see you again.
Good morning, Melissa.
How are you feeling right now as far as testing is concerned? Are you seeing and hearing about more people getting tested these days?
Yes, with the recent Delta variant in the community, over the last several days, we've seen a significant rise in the number of testing. In fact, we at Kelsey have now doubled what we were doing before this recent rise. And I know we haven't spoken in a while, but some of your viewers may are wondering about testing and how to get testing. One of the biggest innovations that has occurred since the pandemic started is accessibility to testing. When it first came on, there was absolutely, probably in most cases, very little to almost no testing. Now you can get tested on almost every corner, either with your primary care doctor, drive-through testing at a pharmacy like CVS or Walgreens, and even there are now online options for home and self-testing.
Yeah, and I tell you what, it's so easy because many times you can get the results emailed you within just a few minutes, so you know right then and there, and then you can let your family know, perhaps your boss know. What about home testing? Has that become any more readily available these days?
It has become readily available, especially since we're doing a lot more screening tests. For example, you may be having a large event such as a wedding, going to a sporting event, cruises, travel. And so home online testing is becoming more popular. You can actually buy testing online, delivered to your home, do the self-swab, and then ship it overnight and get a test result.
Good to know. Now, do you have a thought on which test is best? Because you can either go into the pharmacy and buy those, or you can look online and try to find which ones are local. It's kind of hard to know which one would actually be the most, I guess, give you the best, most correct results.
Right. So what I'll tell you is a majority of the testing that is available is very good and very sensitive, but the gold standard test is the PCR test. So that's the one that takes at least 8 hours once it hits the lab to finally get a result. So you typically get a result the next day or 2 days. The rapid test that a lot of people will get as well is very accurate, but it does tend to have less accuracy than the PCR test. But you get results within 12 to 15 minutes.
Yeah, so we've definitely come a long way, because I remember in the beginning it was almost a week before you got some of those results back. So things are definitely progressing. Now, what about the availability of these appointments? Are you finding it fairly easy for people to be able to schedule it even same day or within the next few minutes?
Yeah, right now, even with this rise in cases, we're seeing same day appointments to get testing is very easy to get, even with your primary care physician, or even doing self-testing at testing centers. So it's very easy to get a test. And I will tell you, it's important when you need a test to get it as soon as possible, get the result, because then you're eligible for treatment. And treatment has to be done as soon as possible. And I'm speaking about monoclonal antibody infusions.
All right, speaking of that, what about COVID antibody testing? Is that still recommended?
So COVID antibody testing is not recommended for diagnosis of COVID unless you presented more than 7 to 10 days. And the antibody tests are not near as good as far as telling you what's going on right now. It might be helpful to diagnose a past infection, but the CDC has been very clear about not recommending antibody testing.
All right, good to know. Don't waste your time, money, whatever it takes to put into that then. Dr.
That's
Aga,
right.
always great to talk to you. Thanks for your time from Kelsey-Seybold Clinic today.
Have a good one.
You do the same.